Your vet just told you your pet's liver enzymes are elevated, and now you're wondering, how serious is that? Does this mean liver disease, or is it something less concerning perhaps? I'm Dr. K, and this is Inside Pet Medicine. In this video, I'll walk you through what liver enzymes actually mean and when you should worry. I'm a practicing veterinarian, and I see this all the time. Lab results that sound alarming, but aren't always what they seem. Let's break this down in a way that actually makes sense. When we talk about liver enzymes, we're usually talking about values like ALT and ALP. These are enzymes that live inside liver cells. When those cells are stressed or irritated, those enzymes leak into the bloodstream, and that's what shows up as elevated on your pet's blood work. So here's the key. Elevated liver enzymes don't always mean liver failure. They usually mean the liver is reacting to something. There are a lot of reasons liver enzymes can be elevated. Some of the most common include inflammation or irritation of the liver, medications like steroids or certain drugs, infections, hormonal diseases like Cushing's disease is one example, or even secondary effects from other illnesses. In many cases, the liver is actually responding to something happening elsewhere in the body. Here's when I start to pay closer attention. If the numbers are significantly elevated, to me, this is when liver enzymes are threefold or higher than the upper limit of the normal range. If multiple liver values are abnormal together, if your pet is showing symptoms like vomiting, decreased appetite, or they're lethargic, or if your pet is a cat. Cats are a bit different than dogs here in that they rarely have incidental liver enzyme elevation. Those combinations tell me this might be more than a mild or temporary change. But here's what a lot of people don't realize. Mild elevations in dogs are actually very common. If your pet is acting completely normal and the increase is small, especially if only one liver enzyme is elevated, we often just monitor and recheck. I consider a small elevation to be less than 2 times the high end of the enzyme's normal range. Or sometimes there's a clear, likely explanation, such as the pet was recently taking steroids or other drugs that we know can cause temporary liver enzyme elevations. Those are also instances where we would choose to monitor the pet and recheck the enzyme levels in a few weeks. Not every elevated liver value means something serious. So, what happens next? In many cases, your vet is going to look for patterns over time, not just react to one number. We might recheck blood work in a few weeks, run additional tests like a urinalysis, bile acids, or imaging, or start treatment if there are clear signs of disease. And that decision is always based on the pattern, the severity, and the pet in front of me. So what should you do if you see elevated liver enzymes on your pet's blood work? First, don't panic over one number. It's important to look at the full picture. This includes labs, your pet's symptoms, and history. Follow your vet's recommendations and make sure to ask them questions if you're unsure about anything. If you've ever been confused by your pet's lab results, you're definitely not alone. I'll keep breaking these down in simple, practical terms so you can feel more confident understanding your pet's health. Make sure to subscribe for more vet-explained pet health content.